Good afternoon, everybody. Glad that you're all here on a sort of a gloomy Monday afternoon. We have several things to chat with you about today, and then, of course, we're going to take your questions. So, I want to talk for just a second about the horrendous killing yesterday of a Metro security officer at the Del Mar station, Officer Cook. A young man, 30 years old, I believe, married, 2 little kids, former military, now working for Metro's security contractor. Very senselessly, horrifically shot and murdered by someone that he was talking with, who came off the train there at the Del Mar station. This happened about 10 in the morning, I think it was, fairly early. And so that is, that gets to all of us. I do want to say that due to the good work of our local police agencies, St. Louis City, St. Louis County, the suspect in that case has been arrested. He was arrested this morning early at the Hanley Metrolink station. So I don't believe any charges have been issued yet, but he has been arrested, and so he is in custody. Just a very horrific, another of many assaults on law enforcement that has been occurring this year, and a horrific incident. So I wanted to start with that. Next, we're going to talk about COVID numbers, and then we're going to talk about COVID vaccinations. We have some, I think, very good news to report on that, and then we're going to take your questions. So, COVID numbers are headed in the right direction. The city 7-day average for new cases is now at 56. It's the lowest that it's been in a long time, since sometime in October. That's good. That is an average per 100,000 population of about 19. We compare that with the other counties in our region, it's still considerably lower. But all the counties, every county's looking much, much better than we were a month ago at this time. So that's excellent. Now, going along with that, and let me just say this, city's average is 56. I mentioned that our goal is for that to be under 35. So we're headed in the right direction for the city of St. Louis. Number of people currently hospitalized in the region, the 4 hospital systems in the region, is 546. That's 490 people that are in the hospital COVID positive, and 56 that are suspected of being positive. Again, that's a much lower number than we've had in quite a while. Our goal for that in the region, and this is Pandemic Task Force goal, is to be at 350. We're at 546. Still headed in the right direction. Number of people of that 546, there are 115 people in the ICU, still a pretty high number, and there are 86 people on ventilators. Again, still some very, very sick people that are in the hospital. Now, patients admitted to the hospital, this 7-day average, running 2 days behind, is 65 people. That's a 7-day average. The goal for that is 40. So we are headed in the right direction. A couple of other statistics to report to you is that we are reporting, this was 2 days ago, an R0 factor, that's sort of the reproduction factor, of 0.76. If you remember the discussion about R0 earlier on, when the R0 is below 1, That means your numbers should be going down, because an R naught of 1 means that one positive person infects one other positive person. Sorry, my computer's talking over there. So one positive person would affect one other. When you're at 0.76, which is where we are now, one positive person is affecting 3/4 of a person. This is a rate, of course. So that's good news. The other thing is that the positivity factor right now in the city of St. Louis, 7.9%. The goal is to be at 5. There was a time not that long ago that our positivity factor was close to 20%. So these numbers are all headed in the right direction. It is a combination of people continuing to do the mitigation procedures, wearing their mask, socially distancing, staying within their small group, washing your hands. It's a combination of that, along with people are beginning to get vaccines. We'll begin seeing the impact of that. Now, not many people in the region have had the opportunity to get a vaccine yet, but you know, if the federal government is able to step up the production of these vaccines and the distribution of the vaccines to the state, then we will, more people will get vaccinated. It's quite a difficult situation right now. So many people want to be vaccinated, and the supply of the vaccine just is not there. We know that the state is getting about 75,000 doses a week for the whole state. That's not very much. And so they're distributing it out to the various counties, hospitals, public health agencies, federally qualified health centers. But when you think about, there's 6.2 million people in the state. If half of those people want to get the vaccine, that's over 3 million people, and they need to get it twice, at least right now with the Moderna and the Pfizer vaccines. So you're still up at having to give 6,000 plus shots. And when you're getting 75,000 a week for the whole state, you're just not making the progress on vaccinations that you need to. Very hopeful that the federal government will be able to effectively increase the number, the distribution, the supply, so that we can vaccinate more people. Over the weekend, and this is a really positive, I think, last Tuesday, so 6 days ago, the City of St. Louis Health Department received 3,900 doses of the vaccine. Now, you've all probably heard that in some of the vials, each vial is supposed to have 5 doses in it, but sometimes you can get 6 out of it. So we received 3,900. We vaccinated 4,498 people exactly. So we did get an extra 600 doses out of that 3,900 vials that we got. Now, there's, a lot of people talking about, well, who got vaccinated? So let me just walk through that with you. We were able to vaccinate we had vaccinations Thursday, Friday, and Saturday. Thursday and Friday were for primarily first responders and health agencies. And so those two events were for those people. We were able to vaccinate all of our police department, police officers, and folks who work for the police department who wanted it. It's voluntary. All the firefighters who wanted it, that's voluntary. All the sheriffs, all the corrections officers, building division people who go out and inspect buildings. So people that were city employees that were frontline workers. Vaccinated all of them who wanted to get vaccinated. We also vaccinated the Red Cross. We vaccinated homeless outreach workers who are caring for the homeless in some of the shelters. We vaccinated some healthcare workers that are not affiliated with hospitals. So all of those folks, they were our first priority. They are phase 1A or phase 1B, tier 1 people. We were also then on Saturday, we invited 1,000 people to get, this was on Friday, we invited for Saturday, 1,000 people. We used our sign-up sheet, our sign-up list that's available online that we put out on the 13th of January. We put it up at about 1:30 in the afternoon that day. We went to the first 1,000 people who signed up who were either over 65 or who said they had an underlying health condition, and checked one of those boxes. We invited those people. Those people, the vast majority of those people did show up on Saturday and were able to get the vaccination. Also on Saturday, we continued to vaccinate police officers, corrections officers, people that were in the prior groups. We have seen on social media that some people said, oh, I was able to get the vaccine and I didn't have an underlying health condition. I don't have access to what health condition people have, but the health department does. And we have checked a number of those people who have said that they didn't have an underlying health condition. And, they did check a box. We take people at their word. And so those people were able to get vaccinated as part of the first 1,000. I'll tell you, and I was texting with a friend over the weekend who said, well, I signed up on the 13th, and she did, but she signed up at 11 p.m. This first 1,000 people that were over 65 and or who had underlying health conditions were only the people that signed up between about 1:30 in the afternoon and 7:30 in the evening. So the sign up was that quick. So we took that first 1,000 people who met the criteria and we invited them to get the vaccine. Towards the end of the day, there were people, because what happens is people were texting their friends, their relatives, hey, come down to Union Station, you might be able to get a vaccine. We had, on Saturday, we were personally had someone working the line outside. We sent away, I'm sure, more than 1,000 people saying you don't qualify, you're not over 65, and you don't have an underlying health condition. I mean, those people, they were there to maybe they'd get lucky and get the vaccine. Nothing wrong with that approach. People are very desperate to get this vaccine. Most of those people were sent away. Towards the very end of the day, when we had some doses left, we said we're not going to waste even one dose. And so some people who were in line, who had waited and waited, were able to get the dose. So that's really it in a nutshell. Let's focus on the positive here, which is that 4,498 people got vaccinated in the city of St. Louis on Thursday, Friday, and Saturday. The health department, our police officers, the National Guard, the bike unit, our police cadets, our police academy, our EMS workers. There were probably about 120 people who worked, our health department, of course, who worked that event to be able to orchestrate that 4,498 people getting their first dose. So 4,498 people are half vaccinated now. And I'm so pleased to report that all of our first responders who work for the city are vaccinated, those who want to be vaccinated. So that's really that's the story on vaccinations. Now, we did learn we learned today that we will get 975 doses this week. And we're going to strategize today and tomorrow about how we're going to give out those doses. We don't know what we will get for next week. We have heard that St. Louis County has been named the point of contact for the region. That would be city, county, St. Charles, Franklin, Jefferson. We're working, that was announced this morning, we're working to figure out what that means. But this pandemic mentality is really, it's very challenging for people. I mean, there are folks that are kind of willing to elbow their neighbors out of the way to be able to get that vaccine. We are taking people at their word. And the point here is to get people vaccinated. So we did about 750 people a week before last through the help of Southside Hospital, formerly St. Alexius, and we did about 400 people. So that's the 750, and then we did the 4,500. So, you know, we've vaccinated 5,250 people in the city. We're proud of that. It was a very successful event, and but we just need so many more because, you know, there are 300,000 people in the city. About 60,000 of them are kids under 18. So, you know, you're talking about 240,000 people, and we've vaccinated 5,250. It's still good because we just have to keep working at this, and the federal government has got to increase the supply, and the state has got to increase the supply to us. So we're all working on that. Everybody wants to do that. So that's vaccinations. I think that's all I was going to chat with you about today. You have questions?
A couple of questions. So some folks have asked about future vaccination events, and particularly if any of the stadiums or large attractions in the city will become mass vaccination sites moving forward.
That is possible, but right now we do not know what our supply is going to be. You know, maybe we'll do a drive-through event. Maybe we'll do. We know from Saturday, from the last 3 days, that thousands and thousands of people will show up to those events. And in my opinion, the region needs to get a much better distribution system. You should be able to get vaccinated at Walgreens or CVS or an urgent care center, but the problem is those places don't have vaccinations now. They don't have the vaccine. So as soon as we know what our supply is going to be, we're going to figure out how to distribute that supply.
We also have some folks who are watching with questions about they've signed up on the city's notification system, haven't been notified yet. When can they expect to hear from us? And what can we tell them in the meantime?
Well, as I mentioned just a minute ago, we invited the first 1,000 people who were either over 65 or had underlying health conditions. And that is phase 1B, tier 2. That's what's eligible. But there are thousands more people on that list who are over 65 or have underlying health conditions. And right now, we don't have any vaccines for them. This is happening all across the United States. This is not something unique to St. Louis or unique to our region or even unique to Missouri. But in my mind, the state of Missouri should be getting a lot more than 75,000 doses per week. If you think about the population of our country, let's call it 310 million people, give or take. The state of Missouri has 6 million people. Well, we ought to be getting 2% of whatever supply is available. And even if, you know, you've heard the 1 million doses a day, we should be getting more. So I'm sorry, I don't know what to tell you. There are thousands and thousands of people who want to get this vaccine, and there's no vaccine to give them right now. I think this will get better. It's like everything else has been in this pandemic. There's been a shortage. There's been a problem with the logistics. But when the city of St. Louis got the doses that we got last Tuesday, 6 days ago, we very quickly put together a really efficient and a good plan to get those doses into arms, which is honestly the only thing that counts.
We've had a couple of questions and viewers asking, you talk about the numbers headed in the right direction. Mm-hmm. Is there beginning to be conversations in the city about whether any of the COVID mitigation strategies will be lifted or rescinded?
You know, lifting or rescinding the COVID mitigation strategies with regard, you're probably asking about bars and restaurants and that sort of thing. It is there on the back of our mind, but in the city, we never closed bars and restaurants. We said 50% occupancy, closing time 11 p.m. Right now, that still looks pretty reasonable to us. We've got to have people follow those, and the vast majority of the businesses are following those. You probably know that St. Louis County just yesterday afternoon Their occupancy is 25%, and you had to close at 10. Yesterday, they closed it to where it's still 25%, but they can now close at 11. The city, we're going to leave things as they are for right now. When we start hitting our goals of 35 cases a day, 350 people in the hospital, 40 people on average being admitted to the hospital, positivity rate of 5, when we start hitting those goals for a little while, then we will think about how to lift some of those limitations. But I know some bars and restaurants really want to stay open later than 11 p.m. But what we feel like we've done here is set some very reasonable strategies, kept them open at 50%. Of course, you have to wear masks there. You have to socially distance. We've also kept a lot of people working in that industry who would not otherwise have been able to work. So we're trying to balance those two things.
Some viewers today received their vaccination on Saturday at Union Station and are asking about the follow-up process, about when they'll be notified and where they should be going for their second booster shot.
Well, you all got a card when you were there. If you got the vaccine at Union Station yesterday, or not yesterday, Thursday, Friday, Saturday, you got a card. It's your vaccination card. It says what vaccine you got. Turn it over on the back. It tells you what day to come back. You'll be coming back to Union Station. So don't lose that card. You're going to have to bring it with you. So if you put it in your pocket, coat pocket, go find it, put it in a safe place.
Questions about vaccinations becoming available for people who work in education and teachers. Amy is asking when we might be able to move into that phase.
Amy, that is such a great question. We don't make up these phases, by the way. The CDC and the state of Missouri have determined that child care workers, teachers, grocery store workers are in phase 1B tier 3. So that is the next phase. But I don't want to give you hope that we're going to get to that next phase soon, because there's so many people over 65 or with underlying health conditions that's phase 1B tier 2 that we haven't gotten to yet. So I'm sure the state will at some point tell us when we can open it up to teachers and childcare workers and essential workers. And it can't come soon enough for me, but we just have to have the supply of vaccines so that we can get to those 65-year-olds and the people with underlying health conditions.
Are the vaccination opportunities open to people who don't live in the city and vice versa? Are you allowed to go to other jurisdictions and be vaccinated?
You are. As a region, we have said, St. Louis County has a sign-up. We have a sign-up. BJC has a sign-up. St. Luke's, SSM, Mercy, they all have sign-ups. And if you're like me, I'm on a number of those sign-ups. So yes, when you have the opportunity to get the vaccine, take it, get it.
That is it for questions, Mayor.
That's all the questions. Good. Okay. Thank you all. Appreciate you being with us today. Try to have some patience. I'm out of patience, I'll tell you that right now. But I'm asking you, try to have some patience. And, when the city of St. Louis gets vaccine from the state, we will get it out to the qualified folks as soon as possible. Thank you all.